this 3-module course, you'll come to understand when and where individuals with obesity experience weight discrimination and how you can help eliminate this form of discrimination within your practice or healthcare facility. Welcome. After completing this module, you'll understand the struggle and pain people with obesity face, identify experiences which impact the quality of life, and recognize the need for empathy. Finally, we'll discuss how healthcare professionals can use this information to best support the patient. Obesity negatively impacts an individual's physical, emotional, and social well-being. The best way to understand the challenges of obesity is by listening to stories of people who have faced this disease firsthand. Let's first meet Andy. She has struggled with her weight her entire life.
I probably gained and lost the same 40 to 50 pounds all the way till my early 20s. And then I was really struggling to keep it under wraps.
Studies suggest that the weight cycling Andy experienced can impact a person's quality of life, and this is directly proportional to a person's BMI. Now let's meet Barbara and Gail. Barbara was deeply hurt because she was made fun of every single day because of her weight as a child. Gail remembers her permanent scars from childhood and the stress and depression associated with it.
Since junior high until about a month and a half ago, there was not one day that went by unless I stayed in the house that I was not made fun of for being fat. And so that is about 25 years of being made fun of every single day for being fat. Whether it was a child saying, "Mommy, look, she's going to have twins," or a teenager. I actually have, when I was trying to exercise, have had eggs thrown at me, rotten oranges thrown at me out of car windows from teenagers, or adults saying, looking at your grocery cart and saying, "Do you think you should eat all that?"
It was hard, especially as a child, or even as a teenager, that, nobody wanted to be with you because you were considered the oddball. You were not the size and shape that they expect you to be. So it caused a great deal of stress on you, a lot of depression.
Barbara and Gail were adolescents who were victims of weight bias. They were subjected to stereotyping, rejection, and prejudice. Unfortunately, they're not alone. Children and teens may face verbal teasing such as name-calling, bullying, and even social exclusion from sports teams or other peer activities. For children and teens with obesity, these obstacles may be faced every single day. Studies show that about 1/3 of overweight girls and about 1/4 of overweight boys report being teased. And as the rate of obesity increases, teasing increases proportionately to approximately 60% for girls and boys. People like Barbara and Gail may never forget the prejudice and discrimination they endured as children. Now let's hear from Gail again and meet Cheryl. They'll describe what it's like to have obesity in a normal weight society.
I didn't like going out in public because people staring, look at this thing that's coming this way, look at the size of her, she needs to just quit eating type thing, especially when you'd go out to dinner and you'd sit down and you would eat dinner. People would say that's how she got the way she is because she's eating and constantly eating. So I had very low self-esteem, no self-confidence, and it caused a lot of depression to where I did not want to go out and be in the public.
Because people shouldn't be treating people when they're fat different than when they are now. Because in my mind, I'm still the same person. They didn't fix my head. They only fixed the body. So I'm still the same person mentally. But you do get a lot more attention and be treated different. You get the best seats in the restaurant. They're not sitting you way in the back in the kitchen area or by the bathroom. They're sitting you say, "Hey, I want to be up closer." Whereas before I would ask, "Can I sit over here?" They go, "Oh, well, those tables are reserved. We got nice seats back over here in the corner somewhere, But now they can sit you anywhere you want. They go, "Oh, yeah, front and center, And it's just amazing, the attention you get, and they treat you a lot better now than they did back then.
Gail and Cheryl are not unlike others who suffered from the disease of obesity. They both described how society treated them differently. For Gail, this led to poor self-esteem, low confidence, and depression. And perhaps Cheryl states it best when she says she is the same person regardless of her body size. Now let's meet Ed and learn how obesity impacts his life.
Do not go places much anymore like I did with a lot of people. Going to church, I do go to church, but it's almost got to the point with my diabetes problem that my blood sugar will drop during the church service and I have to get up and leave the church service, and it's kind of frustrating. I get extremely tired, short of breath, walking short distances, standing short periods of time. So it has really put a damper on my life.
Ed, like many individuals with obesity, suffers from associated comorbid conditions. According to the National Institutes of Health, overweight individuals and people with obesity face a higher risk of comorbid conditions such as hypertension, type 2 diabetes, heart disease, stroke, sleep apnea, and more. Ed's story emphasizes the need to lose weight in order to improve and sometimes resolve these comorbid conditions. Now, Elaine will share what she's experienced in the workplace as a person with obesity.
With the job situation, I would interview for a job that I had all the requirements and would be able to do a good job, but I felt like I was discriminated against because of my weight. They thought that since I was overweight, I'd be lazy or wouldn't be able to do the job effectively, or I'd be out sick a lot.
Elaine is not alone. Negative stereotypes exist in many workplace settings. According to a qualitative review on weight bias in a workplace setting, obesity can be a barrier to employment and professional success. Individuals with obesity often face negative attitudes and experience unequal treatment in the workplace. Not only is obesity misunderstood in the workplace, but many healthcare professionals also have preconceived ideas about obesity. They don't seem to recognize the struggles individuals with obesity face. Let's hear from Gail.
I did have a primary physician. He basically did not recommend the surgery because he felt that your size was just due to overeating. Just push yourself away from the table and you won't have a problem.
If the cure for obesity were as simple as pushing oneself away from the table, we would not be facing obesity in epidemic proportions both in the United States and internationally. A cross-sectional study was conducted looking at physicians' attitudes towards patients with obesity, obesity treatment, and obesity as a disease. Examples of survey questions used to assess physicians' attitudes were: I feel uncomfortable when examining an obese patient, and it's difficult for me to feel empathy when examining an obese patient. The second target area was attitudes toward treatment, and examples of these included: obesity is a treatable condition, and most obese patients will not lose a significant amount of weight. The final section looked at attitudes toward obesity as a disease and asked, is obesity primarily caused by behavioral factors? The study results showed that 40% of physicians had a negative attitude towards patients with obesity. This study proves evidence showing physicians may not always adequately counsel patients with obesity. Their attitudes and misperceptions may be the reason. Negative attitudes about patients with obesity have been reported by physicians, nurses, dietitians, psychologists, and medical students. Research shows that even healthcare professionals that specialize in the treatment of obesity still hold negative attitudes. Let's hear more, this time from Virginia.
What I found was most physicians did not understand the bariatric situation. I had to educate my primary care physician because he knew nothing about it. So I gave him a lot of material. We had long talks. I put him in touch with Dr. Smith. I sent 3 people to his office that had had the surgery, that he could talk with them, and It was a long process, but once he got a grip, he has recommended 4 more people for the surgery.
Some physicians don't have all the information they need to feel confident referring patients for bariatric surgery. It's important for physicians to understand that surgery is an option for patients with obesity that have a BMI greater than or equal to 40 or a BMI greater than or equal to 35 with comorbid conditions. Some patients feel surgery will provide them with an opportunity to change their lives. Now listen as Virginia shares why she looks forward to bariatric surgery.
I'm looking forward to being active with my children, my grandchildren. I'm looking forward to do normal things. I'm tired of going in a restaurant or going somewhere and looking for a chair big enough. Now, these chairs are big enough, but most places you go, they're not big enough. When I go to the auditorium for in-services, they have these little seats that have the little flip-over desk. I can't sit in those. I look forward to not having to concentrate and worry about food, not having to pack a pharmaceutical company with me when I visit relatives in South Georgia. I look forward to having freedom. I look forward to being active, to doing things that normal people do. I look forward to shopping in the Walmart for clothes. I mean, that's important to me. I'm tired of paying $60 for a Lane Bryant dress. It's important to me that people don't stare at me. It's important that seat belts fit me in other people's vehicles. It's important for me to bend over and tie my shoes.
Virginia describes the physical and mental liberations that she'll experience by losing weight. The everyday activities that normal weight individuals take for granted will no longer be an obstacle for Virginia. As a healthcare professional, you'll care for individuals with obesity throughout the entire healthcare facility. Recognize that each patient has a uniquely personal story and suffers from obesity for different reasons. Obesity is a multifactorial disease.
Every patient believes that they're the only one it's not going to work on because they've tried every diet in the world. They've been successful on every diet in the world and gained all their weight back and more. So this is their last-ditch effort. This is their last chance at a normal life, and they believe they have an abnormal life. Watching things from the sidelines, not taking part in their children's lives or their husband's lives.
It's important to recognize all of the challenges individuals with obesity face. When they decide to have surgery, they're often afraid that that decision may not work. They present your healthcare center with a lifetime of stories like the one you heard today. Always be sensitive to each individual's unique needs. Listen to their stories. Show respect and provide a reassuring, compassionate appreciation for what they share. As healthcare professionals, it's important to understand that individuals with obesity have negative memories and experiences that are deeply rooted. Your eye contact, smile, and warmth can provide a welcoming environment, and you can support a culture of sensitivity.